Good morning, everyone, and welcome to this week's community update. I want to begin by echoing the solidarity and support we have seen across the region of Waterloo for Baital Karim Mosque. I cannot imagine the impact of trauma experienced by our local Muslim community, including many of our staff members here at the region. We are thinking of them after this disturbing and hateful act. I also want to extend our thoughts to the city of Barrie and Mayor Lehman as they deal with the aftermath of a tornado. Today, Ontario enters step 3 of the provincial roadmap to reopening. This is only possible due to the incredible progress made on vaccines. This includes the mass vaccination clinic at Binghamton's last weekend that helped us set new records, but also includes our other clinics, mobile teams, primary care physicians, and pharmacies, all integral parts of our making this community safe. Thank you to all the volunteers and staff, as well as the residents who are protecting themselves and our community by getting vaccinated. We aren't at the finish line yet. Step 3 brings us closer to a full opening, but we're not there yet. We need 80% of eligible population age 12 and over to have received their first dose and 75% to have received their second dose. If you aren't yet fully vaccinated, please get your first dose. And if you are, think about how you can help your neighbor, your friend, or family member get vaccinated. Every dose really does count. We have one enforcement update from the last media update, and that's a $240 ticket issued by the corporate security at 143 Concession Street in Cambridge for failing to comply with a face covering bylaw. As discussed last week, we also had a multi-ministerial provincial inspection team in the region. They inspected 76 local businesses and provided education on the requirements of the Occupational Health and Safety Act and the Reopening Ontario Act. Locally, the COVID-19 Safe Ambassador Program will continue to help employers mitigate health and safety issues. More than 1,000 small and medium-sized businesses have already participated in this program, a partnership between the region and local chambers of commerce. As we move to step 3, it's important that we stay vigilant and continue to follow public health measures. For more on these measures and the COVID-19 case rates in the region, I'll now turn things over to our Medical Officer of Health, Dr. Wong.
Thank you, Chair Redmond, and good morning, everyone. So I'll start with my key messages, and then I'll go into a little more detail on each. So the first highlight is that we continue to see improvements in our public health and healthcare indicators. The second one is, thanks to our community, our vaccine ramp up was a huge success. When our vaccine dashboard refreshes later today, you will see that 80% of all residents 12 and older have received a first dose. Waterloo region has one of the highest first dose coverage rates in Ontario. And the third point is, as we enter step 3, we now have to work together to safely reopen and stay open. We all have a role in this. Please remember, if you go to work when you are not feeling well, you are putting others at risk. If you send a child to camp with symptoms, they can spread COVID-19 to other kids and staff, and that group of children will have to be dismissed, which hurts everyone. And if you increase your contacts without taking precautions, you can spread COVID-19 across our community. Each of our daily actions can help us return to and enjoy everything our incredible community has to offer. A little more regarding our overall trends. We continue to see improvements in our indicators. Our incidence rate is now at our lowest level since early November 2020. We also successfully ramped up our vaccine rollout and have pushed first dose coverage to being one of the highest in Ontario at this time. Case rates, number of active cases, and number of active outbreaks continue to slowly decline. Hospitalizations have also started to decrease and remain stable at this time. With the very high transmissibility and aggressiveness of Delta, the spread is not expected to slow quickly, and we could have flare-ups. That is why increasing vaccination rates and continuing to follow public health measures is paramount to our continued success in reopening. Public health measures remain critical. They continue to play a critical role in limiting and controlling the spread of COVID-19. We can reopen and limit the spread of the Delta variant if we continue to get vaccinated as soon as we're eligible, continue to practice public health measures diligently. Please remember, avoid enclosed spaces and crowded places. When indoors, ensure the space is well ventilated and continue to wear masks and physically distance. And where possible, favor the outdoors for permitted activities. Be cautious as you add more activities for you and your family. Consider who you would need to identify if you are exposed to or contract COVID-19. Consider those in your life who are at risk, such as those who are most at risk for serious illness as a result of COVID-19 or those who cannot yet be vaccinated. All residents are reminded of the importance of not attending work or group activities such as camp when they or their children have symptoms. With the opening of camps, we are seeing more cases and outbreaks in camps. If you or someone in your household is experiencing any new symptoms of COVID-19, stay home. If you are experiencing symptoms, self-isolate from household members and schedule an appointment for testing at a local testing center. If you cannot safely isolate at home, our safe isolation site is available at no cost. In closing, step 3 will increase the risks of spread. All Waterloo Region residents should get their second dose as soon as they can. If you have an appointment booked for later in the summer or fall, please move up your appointment to an earlier date. You may book as early as 28 days if your first dose was Moderna or Pfizer, and anyone who received AstraZeneca as their first dose is already eligible to receive their second dose. Full immunization, 2 doses in 2 weeks, is our best protection against Delta. Don't delay your second dose. As we enter step 3, we now have to work together to safely reopen and stay open. We all have a role in this. Please remember, again, if you go to work when you are not feeling well, you are putting others at risk. If you send a child to camp with symptoms, they can spread COVID-19 to other kids and staff, and the whole group will have to be dismissed, which hurts everyone. If you increase your contacts without taking precautions, you can spread COVID across our community. Each of our daily actions can help us return to and enjoy everything our incredible community has to offer. Thank you, Waterloo Region residents, for stepping up to push back Delta and allowing us to move forward towards reopening. It's important that we do not let up now. We've had great success, but we still have a ways to go. Let's keep moving forward. Thank you.
Thank you, Dr. Wong. And we'll now turn to CAO of the Region of Waterloo, Mr. Bruce Lochner, to provide a vaccine rollout update on behalf of Deputy Hilton. Welcome.
Great, thanks, Chair Redmond, and good morning, everybody. Good to see you. As Dr. Wong said, we have one of the highest first dose coverage rates in Ontario. Today, we reached 80% of all residents 12 and up with a first dose, and that's just fantastic. We've also cut up at light speed to the rest of the province for second doses, with more than 55% of our eligible population being vaccinated. So we knew once we received vaccine from the province and had enough supply that the community would respond. And I can't thank residents enough for stepping up and getting vaccinated. Our various models of vaccination have worked so well, from from pharmacies to primary care to our clinics, our drive-throughs. We had a clinic, as all of you know, at Binghamton's on the weekend, and I was able to do a couple of shifts there, and it was a happy place. What amazed me most was just the energy in the room of healthcare workers, paramedic nurses, doctors, volunteer staff. After a year and a half of this, just that last push to move forward, and also seeing volunteers from all walks of life. I happened to do a shift, and standing beside me was a teacher, and she just wanted to give back to community. I saw some community leaders from not-for-profit organizations there as well. So that's what Waterloo Region's all about, and I just have to say it warmed my heart to be part of that and see the community step up. The vaccine dashboard will now focus on our efforts to vaccinate all eligible residents who are 12 plus, as opposed to the 18 plus highlighted before. So you'll start to see that information more pronounced on the front page in the days ahead. In terms of capacity, vaccine supply remains steady and clinics continue to run at max capacity. Binghamton's will continue to run until Sunday with a hockey hub model. And next week, we'll start to shift to a couple of things. One is more drive-through clinics. And I wanted to announce today, you'll see more information in the form of a media release, that drive-through clinics will run Tuesday, July 20th through to Thursday, July 22nd from 5 p.m. to 9 p.m. Appointments are required for second doses, and walk-ins are always welcome for first doses. We'll start to schedule or release appointments around noon today. And as I said, more information is going to follow in terms of social media as well as a media release. A reminder that first dose walk-ins are welcome at all regional clinics. And as we have the opportunity for more second dose walk-ins, we'll advertise those. We'll also be wrapping up our community clinics and working to get out even more in different communities with mobile clinics with more pop-ups. And also we're expanding our support to ParaMed, which is the home care organization that we're working with to vaccinate those who are housebound. In terms of where areas we're targeting, we have really good data, and we're using that data to drive the areas with lower vaccine coverage, where we will add those pop-ups and mobile clinics. And again, I'm thankful to community leaders, to our area municipalities, to religious leaders, and so on, who are conveying messages and welcoming us into various communities and ensuring that we meet the community in approaches that suit their needs. So very thankful. And again, that speaks to this community once again, and just how great our community leaders are, and our leaders in our various organizations are as well. As Dr. Wong has said, vaccination is key to our community reopening. I know people are still saying, hey, I've got an appointment in August. You know, what's the big deal? Although it may not seem to be a big deal, but if we want to keep our businesses open, as Dr. Wong has said, get vaccinated. We have lots of vaccine in the coming weeks, and there's no reason why people who are eligible and able to get to vaccine clinics in a couple of weeks should delay their appointments to August or September. We really need them to get vaccinated now. So with that, Madam Chair, back to you. Thanks very much.
Sorry, I'm fighting with my mouse here. Thank you, Mr. Lochner. I'd now like to turn things over to our guest, Patrick Gascon, who is CEO of Cambridge Memorial Hospital, to share what he's seeing in the community and the work that Cambridge Memorial is doing to help our community through this pandemic. And just before I turn the floor over to you, I do have to give you a shout out as one of our many volunteers that were at the Mass Clinic. I know you and Lee Fairclough were there, and it warmed my heart to see that for all you do in your work day, you were there to volunteer as so many other people were. So thank you for that, and the floor is yours.
Thank you very much, Chair Redmond. And I should also recognize my wife does it every week. And while she doesn't get Chair Redmond thanking her, I'll extend my thanks to Fiona, who does it time in and time out each week and enjoys being part of the vaccination effort in the community. I want to start by sort of taking us back, because it's really the first time I can sort of publicly thank Dr. Wong for holding us back as a region. And it takes courage to do that. And without that, the hospital system would have been crushed. And I think we need to know that took that took courage to do. And I want to thank her on behalf of the community for that brave and courageous effort for that. As a result of that, the hospital system is more stabilized at this stage. Each hospital is managing the capacity of their COVID patients and the other importantly, the other patients within the hospital as well. As we focus maybe on the intensive care capacity, we are still smoothing patients between hospitals. So what that means is we are moving patients as most recently as this week, we moved patients among the Waterloo Regional Hospitals. That's who need intensive care support. That's a normal process for us, so it's not unheard of. Perhaps we're doing a little bit more through the pandemic, but we do work as a system in order to meet the intensive care capacity and to make sure that patients are cared for. If I look at our stats compared ourselves compared to the province right now, and yesterday's dashboard province-wide, there are 157 COVID-related critical illness (CRCI) patients in the system. And so that's COVID or COVID recovered within the ICU. So we get provincial trends. So 157, and we think of ourselves as 5% of the population. Well, right now, we're actually 10% of that number. There are 16 in Waterloo region that are COVID-related critical ill patients in our ICUs for that. And I think it just speaks to the point Dr. Wong has raised around the insidiousness of the Delta variant, the impact it can have very quickly on the hospital system. We are managing that now, and we need our community to continue to get vaccinated, stay safe, isolate as much as possible, wear a mask, use the hand hygiene. Yes, the things you've heard for many years, but keep at it, because as much as we want to come out of that, we could very quickly turn the wrong direction and see a hospital system overwhelmed. We want to do, as everyone does, more than COVID. And so each hospital is working towards our service resumption. So particularly surgical services and procedures, diagnostic imaging, some things that we have not, we had ramped back in the past. So every hospital is working towards that. At Cambridge Memorial, we anticipate being within a week at full service in terms of our surgical and procedures. We had a small hiccup as we dealt with a ventilation issue where we found a non-toxic mold in one of our fan systems and had to reduce our surgical and endoscopy procedures as a result of that. We anticipate that to be fully resolved and back to kind of full operations on the surgical services and endoscopy as of next week. People ask quite rightly about visitors and care partners within the hospital system for that as we're opening up. And so again, each hospital is working towards improving that. Hospitals generally, and CMH particularly, has a 24-hour, 7-day-a-week care partner visiting policy, which we've had to suspend through this pandemic for that. So generally, we enable care partners to stay as long as they want. They're an important part of the care team for that. We've obviously had to suspend that. We continue to look and review almost every other day in terms of what our policy is around care partners and visitors. We have a number of options and we've added outdoor visiting as well. We've added virtual options, and we have bedside options available for that. But each hospital, again, sees the importance of care partners, but wants to work slowly given the situation. I'd like to just sort of shift the message from the kind of the hospital capacity to the community. And while I have the floor, I think just to remind us as the kind of 15 or 16 months we've been in, how the community has stepped forward to support the hospital system. So I think locally, I look to Mitographics, I look to Eclipse Automation, Mitographics, who made intubation boxes for us. I look to Eclipse Automation, who made medical grade masks and stepped forward to be able to I look at the work that Canadian Shield has done, and the thousands of Canadian Shield masks that are worn by our staff within this organization. And then I look very specifically at Cambridge to the 57,000 masks made by our community mask makers for that, to be able to support our patients. And 1 in 3 people in Cambridge really has a mask made by our community mask makers. It was an incredible effort that has transpired across this region. I think it also gives pause to remembering the importance of kind of made in Canada, made in Waterloo, as we think forward into the future, every opportunity we can to look at how do we drive and make sure that we have a stable personal protective equipment supply in order to support Waterloo residents for the next pandemic. Special shout out to the region, the Stay Safe program, the work with Communitech. For that, again, another initiative that was born in this region, in order to kind of keep our communities safe. Bringing it home to the staff here, I have to applaud the staff and physicians and volunteers at the hospital in terms of the work that they have done. So both caring for COVID patients, but as well as supporting the community. So we have worked with retirement homes and long-term care facilities to be able to provide support to them. The Pine Bush Vaccination Center, in terms of a number of our pharmacy staff that are working there regularly for that, the Bingamans that has been referenced for that, and the number of staff that worked at that. I think it's been a tremendous community effort. I'd like to just close on kind of two stories. One is I tweeted last weekend, it really was the best day of the pandemic. That the Bingamans actually seeing Shuli, who I have not seen for like, it felt like 2 years, actually physically seeing a few people, and Chair Redmond, yourself, and a few others. It was just, it was just the best day ever of the pandemic when you saw people. And what struck me most in seeing, I didn't see all 20,000 people, but what really struck me was the 20-something-year-olds that came in for their second dose, but most importantly, they had their father for their first dose. And what it really struck me was, if you're going to get vaccinated for anybody, do it for your family. And they had convinced their father the importance of vaccination. I thought, it's usually the other way around or whatever. I thought, good for you. And I was so proud of those kids that had brought that along. And then as I think about the care providers in here, I'm struck by a conversation I had with a nurse some months ago who described a situation where she, because of COVID and COVID restrictions and the fact that the patient that we were caring for's family all had COVID and couldn't come in, she spent her shift holding the hand of a dying patient. And she said it was the most poignant day of her life, that she was so proud to be a nurse that day. And what struck me was, that obviously that pride and for me to be able to work with and hear that story from one of our staff. But it also struck me the mental health toll on our healthcare providers. Everyone's excited and we want to celebrate, and we come to this stage where we're opening up for it. We have to remember, do it cautiously as we've been advised for that, but we also have to take the time to allow our healthcare providers to heal, to recover, and to become whole again for that. There's been a huge impact on the healthcare system from COVID and on healthcare providers particularly, and I think we can't lose sight of that. And with that, I'm happy to close, to pass it back to you, Chair Redmond. It's an honor to be with you, and again, a shout out to everyone across the region in terms of the work they're doing. Particular shout out to Dr. Wong, who day in, day out, all the work that she has done. I just can't, we're in great hands in this region by the effort and the work of everyone, and particularly Dr. Wong. Back to you, Chair Redmond.
Thank you so much, Patrick, for that very heartfelt, important message. And I just, at this point, want to give a shout out to Fiona to be an equal opportunity person. So a shout out and thank you to Fiona and all the other people that have actually approached volunteering in our vaccine clinics as though it were a job. And Fiona and Patrick and the 600 people that made last weekend happen at Bingaman's and the people that do it on an ongoing basis, we are all in your debt. So thank you very much. I will now open it up to questions. Joanna, do you have a question?
Yes, I do. First, a question for Dr. Wong. You mentioned a few times that people shouldn't go to work or go to camp if they have symptoms. Is that an especially important message now? And do you think it's one that people will readily follow just because it's not sort of habit to stay home if you have symptoms? People try to tough it out.
Thanks for the question, Joanna. Yes, I understand it. It's the reason I mentioned it, right? It's not to shame and blame people, but this is what we're seeing contributing to spread. When people think, oh, it's not a big deal, and then one case leads to 10. With Delta, we have seen this spread faster than anything that we have seen to date. And it just reminds us, even though we have better control through vaccination and hopefully continuing increases in vaccination rates, this is why we still have cases today. It is largely due to people no longer taking those precautions or thinking that it's okay. It shouldn't be a problem now. We can't throw caution to the wind at all now. We have to continue with those public health measures. And that's the way we're going to continue to slow the spread of Delta as our community vaccination rates continue to increase.
Joanne, did you have a second question?
Yes, I do. You guys talked about first dose coverage, and we have sort of a last chunk to get through now, which are going to be more difficult. Is the region thinking about ways to sort of adapt the rollout to maybe to get those people like to go to where they are, and what sort of things can we expect to see?
Mr. Lochner?
Yeah, sure. Thank you, Joanna. For sure. I mean, the last pieces are always the most difficult, and it's important that we continue to give access to residents in a variety of different ways. So pharmacies continue to be open. We know primary care physicians and nurse practitioners are having discussions with their patients. They're aware of who hasn't been vaccinated, and that trusted relationship, as we often hear, is an important piece. Our clinics will continue to run, and then the mobile and pop-up. So getting our bus out to different sites and different businesses. We're looking at expanding our program where we actually go out and work with businesses to vaccinate their workers who otherwise, for a variety of reasons, shift work and so on, may not be able to access other clinics. And again, as I said earlier, working with leaders in faith communities, working with community leaders in getting out to community centers and so on. All of these are approaches that have worked to date, and we're being advised by community members that that's what they want, and we'll respond in kind.
Thank you. And Joanna, my understanding is that you gave a shout out on social media to say that you had 2 different doses. So thank you for providing that leadership and that demonstration. You're an influencer in this community, and thank you for doing that. Many of us on this call did that as well too, but it's great to have your voice added. Justine, do you have a question?
I don't at this time. Thank you, though.
Okay. Doug, would you have a question?
Yeah, I guess a lot of people are concerned. They're looking at what's happening in the UK. Can maybe Dr. Wong, if you could explain maybe what's gone wrong there? Is that your fear going forward?
Yeah, no, thanks for the question, Doug. What's happening in the UK and the other countries now, many other countries now, is a cautionary tale. And it really speaks to the importance of, in Ontario and Waterloo region, right, not letting up on our efforts to get everyone vaccinated and fully vaccinated as quickly as we can. That's why, we've really asked people to move up their second doses, right? We can't become complacent. Yes, our situation has improved, and yes, our vaccine coverage has increased rapidly, but we continue to be at risk. And Delta is the most aggressive variant that we have experienced, and it can very quickly flare up. And so that's why we need everyone's help, that as we reopen, we do it cautiously, right? And we take all the measures that we can, in addition to getting vaccinated, to prevent spread. And we, as the restrictions lift on step 3, we can continue to do things such as avoiding closed spaces, crowded places, favoring the outdoors when we can, making sure that if we are indoors, we're in a well-ventilated space, we keep our masks on, and we continue to try to distance from others. So those kinds of things can really help us if each of us continue, to take precautions. Those things can really add up and really help us continue on the road to reopening in a safe and cautious manner. And really, the purpose of all of this is so that we stay open, so that we can continue to move forward. Canada is actually right now the only place that I'm aware of that hasn't had a huge surge. And I think that's because or Ontario, that is, and that's, I think we've done the right thing in taking a stepwise approach. But to continue on along that path, we need all our residents to help us now stay open.
Doug, do you have a second question?
Another thing I'm curious about, I guess, is the under 12 category, and if there's any update on the vaccines being making that group eligible.
That's a great question, Doug, and I know that a lot of parents are wondering about that. So there are trials ongoing for children under 12, and the expectation is the trial results will be ready by the end of September, and the hope is that sometime in October or November we will have approval to start administering vaccines to children under 12. And so we're already planning to be ready to do that as soon as we can. It does remain important that we try to immunize as many children as we can once we know we're able to do so. And that's another reason we have to remain cautious. What we are seeing today is that spread is occurring in those groups, occurring more now in those groups that are less immunized, and including in children under the age of 12. And so there's, obviously immunization that will have a significant impact on that when it becomes available later this fall. But there is also everything we can do now to reduce the level of community spread that can also indirectly help protect children.
Thank you. Nicole, do you have a question?
I do, and I guess it's in line with what you were just speaking about, Dr. Wong. You were reiterating concerns about camps, when you were speaking earlier. Are we seeing more outbreaks in camps locally and across the province? And is this something that, yourself and other medical officers of health are concerned about? Because this is a group that isn't immunized.
No, thanks for the question, Nicole. Yes, and now that we've opened camps, it's not surprising that we are starting to see cases and outbreaks. We just have to really remind everyone that we all have a part to play to try to minimize the spread of COVID in these camps, and there are still precautions with camp activities, and one of the important ones is making sure that if you or someone in your household has symptoms that could be COVID, not to send the children to camp, because that will just lead to spread and the entire camp having to be dismissed. And so we have to continue to be very cautious in those environments, and really strongly recommend that all parents get fully immunized as soon as they can.
Nicole, do you have a second question?
I do. It's a follow-up. Will these camps be reflected at the 1:30 update? Yep. How many camps are you able to say?
Yeah. We'll as of 1:30, you'll see that there are currently 2 outbreaks in the region, in the camp setting. And so that will be available at 1:30.
Okay, Casey, do you have a question?
Yeah, for Dr. Wong, just wondering your take on the vaccine passports. Obviously, Quebec says yes. Ontario seems to be a flat no here.
Yeah, I might actually ask if Bruce might have something to say about that.
Sure.
After you, Bruce.
Oh. Thanks, Dr. Wong. Casey, good question. I know the province has deferred that to the federal government. So we will await to see what the federal government says and take direction from them. I know it's a really important question. I mean, people are wondering about, people who aren't vaccinated coming into their businesses. They're wondering about, their children interacting with others who may not be vaccinated and so on. Certainly not a new discussion. We see that every year when it comes to vaccinations, and we're hopeful that we get some sort of clarity from the province or from the federal government. It's important, this country, what we do in one jurisdiction has to be consistent, in my view, with what we do in another jurisdiction, whether we're talking about a province or the country as a whole. So we really hope and expect some clarity from the federal government as soon as possible. At the same time, I would say, whether we have vaccine passports or not, we need people to get vaccinated, and that's our message today. Let's get vaccines in arms. That's the best thing we can do. We can't always rely on governments to save the day, and a lot of this is in the hands of our public. So lots of vaccine opportunities in the coming weeks. Please get vaccinated, and that's the best thing you can do as an individual.
Dr. Wong, do you want to add anything to that?
I'll only to say that there's lots of availability in the rest of July for people to move up their second dose. Please move up your second dose as soon as you can.
Thank you. Casey, do you have a second question?
Yeah, just Dr. Wong, you mentioned maybe kids can be immunized by the fall, early winter, maybe. Any opinion on adding the COVID vaccine to the list of mandatory vaccinations for students? I imagine that's obviously a ministry thing, but just wondering your opinion on that.
No, I am in favor of policies that help to increase the immunization rates. And, we have for a long time in Ontario had the Immunization of School Pupils Act. And, it's something that does help increase the rates of coverage of vaccine preventable diseases. We have very high rates of coverage for all the vaccine preventable diseases that are part of that act. So yes, it will be a provincial decision. And as Bruce has said, in the meantime, we need to do everything we can to encourage people to get vaccinated, make sure their questions are answered, and make them aware that the best way to protect our children now is to make sure that our adult population and those over 12 who can be vaccinated are fully vaccinated as soon as they can be.
Thank you. I'm going to take a guess, Maureen, that you're in Boyle-Mont. You had a hand up. Maureen, do you have a question? Maybe it wasn't a good guess. I don't think they've been identified. Does anyone else have an additional question? Nicole, go ahead, and then Joanna.
We've heard about a vaccine hesitancy because of the particular brand. I'm just wondering, with international travel opening up and concerns about some countries not recognizing mixed vaccines as being fully vaccinated, how are you addressing that? And have you seen people turning down Moderna as a result of that? Like, did that happen at the hockey hub?
Mr. Locker, do you want to weigh in?
Sure. It's a great question, Nicole. We'll use the example of Barbados, which we know some residents intending travel to Barbados received the message that mixed dosing wouldn't be accepted. Barbados reversed that decision either last night or this morning. And the Prime Minister has communicated that his team is working directly with other countries on this, as we have so many different vaccines around the world. We happen to have a few here that we focus on. But when you think of it from a global perspective, there are so many different vaccines that countries are going to have to work this out. So I'm confident that this will start to resolve itself in the coming days and weeks. And going back to the science that mRNA vaccines are great, and a brand is a brand, and the best vaccine for you is the one that goes in your arm that you can get first.
Dr. Wong, did you want to add anything to that?
Only that the mRNA vaccines, Moderna and Pfizer, are the best vaccines in the world. And so many Canadians and Ontarians have a mixed series. And this is something I am aware that the federal government is actively working on to make sure that other countries recognize the excellent vaccines and vaccine series that our residents have received.
Thank you. Joanna, did you have another question?
Yeah, and I'm not sure who wants to take this, but I guess just generally, is this region ready for step 3?
Bruce?
I, as a non-clinician, heed the advice of people like Dr. Wong and people like Patrick Gaskin, who see the everyday of the effect of COVID, heeding the advice of business leaders who have suffered so much during this pandemic and really want to stay open. I think everybody does. Heed the advice of parents and children who have suffered. We've all faced mental health challenges through this. So it's always a risk to open, and you're hearing from everyone, it's a cautionary tale. We see what has happened in other jurisdictions like the UK, and I really am excited about newfound freedoms. At the same time, believe it's my own obligation, and I hope others share this, to be cautious, to wear a mask, to wash our hands, and to be outdoors as much as possible. If you follow those guidelines, those are the strongest ones: washing your hands, staying outside, staying in well-ventilated areas. If you do go indoors and wear your mask and distance, then we'll be much better off than if we don't.
Dr. Wong, did you want to add to that?
Yeah, we've never had as much control as a community and individually as we have now to stay on the path of opening, because we have the vaccines now. And we also know with experience what works really well in terms of stopping that person-to-person spread. So as Bruce said, we have to remain cautious, but we also have to remember we have the most control we've ever had to date on how our community does in the future. And this is why, right, it's paramount that we continue to get our residents fully vaccinated as soon as we can. And in the meantime, while we're still in the process of reopening and wanting to make sure that that balance of risk and benefit is well maintained, we have to keep up with those public health precautions, each and every one of us, to help our community be able to reopen and stay open.
Patrick, did you want to add anything? I know you commented about deferring step 2. Now that we're in step 3, do you want to reflect on that?
Yeah, it's a great question, and I just echo what has been said around kind of it's in the community's hands in terms of being able to kind of keep us moving forward on this path. If we think about last weekend, where we had 20,000 people vaccinated across the region, those are in 7 days' time. That's 20,000 people who are unlikely to end up in one of our ICUs because they'll have had their 14 days. That is critical to us. We we will be crushed, if we don't continue the push on vaccinations, on continuing our public health measures for that. So, I'm excited, as colleagues have said, around that we're at step 3. We just need to be cautious around this, particularly in the coming days and weeks. And I can't stress enough Dr. Wong's point about move up your second dose. You are not fully vaccinated until 2 weeks past your second dose. It doesn't, get it done, and that this community will stay open and thrive, and we'll move forward for that. Let's push that vaccination. Let's win this race, folks, and let's be the best in Ontario, because we know we are.
Thank you so much. And just, this race isn't over yet. We're not at the finish line. And I think that's the message everyone's giving. I also do, I'm stealing sort of a reflection that Patrick gave over the weekend. And he said the juxtaposition between seeing people coming in to get a vaccine versus the people who are very ill and some of them dying in his hospital was absolutely stunning. And I think that's why you had a little person inside of you doing a happy dance, if not the outside person doing a happy dance. So
that's why it's the best day ever, really. Those people are not, those 20,000 people are unlikely to need hospitalization for that. And that's, we've just got to keep pushing people to that, encouraging that for your family. You don't want to come to the hospital. We don't want you in our ICU.
Thank you so much. Any further questions from the media? Oh, Nicole, go ahead.
The mention of the, I guess, mobile and pop-up clinics, I'm just wondering, are they provided by the province? Can you, mentioned before the resources. I'm wondering where we're at in terms of the resources that we've received from the province and what we are potentially getting over the next few weeks.
Mr. Lochner?
And Dr. Wong can probably give some more specifics. We have received 2 teams from the province. As my understanding, the teams continue to work with us. When we talk about pop-ups and mobile, it really is a team effort. So public health staff, as well as some of our partners from the health system. So it varies. And, we certainly appreciate the support from the province that they gave us, as well as the creativity with our partners like Bruce Power, who allowed us to get more vaccines in arms with fewer resources. So we did have a resource crunch, and it was important that we shift models and continue to shift models as we face challenges in resourcing.
Dr. Wong?
I'll only add that, we still have the 2 ministry teams with us, but as Bruce mentioned, we are intensifying our ground game and continuing to make it easier for residents to get vaccinated. So there's going to be this shift from the mass clinics down to the ground game of mobile clinics and pop-ups, and the ministry will continue to support us as long as we need it.
So I see a hand. Do you want to identify yourself?
Yep, I'm Tiffany from CBC News, Kitchener-Waterloo. I had a campaign question, but Nicole already asked that. I just wanted to kind of follow up on the vaccine question that we had for the children under 12, and that it might not be established until the fall. So I mean, a bit later in the fall, like October. So I was wondering if there was a plan for children under the age of 12 that haven't been vaccinated yet. Are they going to be going back to school as well, or would that be like a virtual learning procedure?
Dr. Wong?
Hi, Tiffany. Yeah, that's the province. That's the province that's going to come out with a plan for return to school. They have indicated they want to try to make schooling as normal as possible, but we're still going to have some precautions for sure. What they'll be exactly, we'll wait to hear from the province, but there's going to have to be some level of precautions still, just because it's not a population that can be immunized yet. But we can do. I know I'm sounding like a broken record, but there's still a lot we can do now to protect our children, and that's through getting everyone 12 and up immunized as quickly as possible.
I see no further questions, so I want to thank our media partners, the community who are watching this through YouTube or live streaming. Thank you, Patrick, for being our guest. I hope everyone has a safe and healthy weekend, and we will see you next week. Take care.
Thank you.